Hello, we're nursing students from University of California, Irvine. My name is Delirium.
My name's Rebecca.
My name is Gabriella.
And I'm Marwa.
And today we're going to be presenting on caring for older adults' depression.
We would like to begin saying our thanks and gratitude, and here are our acknowledgements. And here is the outline of what we will be talking about this presentation. So we will begin with what is older adult depression, then move on to signs and symptoms, and we will end with care and prevention.
So before we jump right in, we're going to start with a small pop quiz. And so the question is, depression is a normal part of growing old, true or false? And so the answer is false, and I'll get into that next. And so we're going to start by answering what older adult depression or depression itself is. And so depression is a mood disorder, and it is not at all a normal part of aging. A lot of older adults do, in fact, report feeling more satisfied towards the end of their life. So if you notice an older adult feeling or showing signs and symptoms, which we will discuss later, of depression, that's not a normal part of just them growing older. And then depression also affects your emotions and your mental health, and then how you interact with the world around you and yourself personally. And so there are three types of depression. There's minor depression, where the symptoms don't last as long and aren't as severe as those of major depression or persistent depressive disorder. Still a serious condition, however. And then the next condition is persistent depressive disorder, also known as dysthymia. And so the symptoms here aren't as severe as those of major depression, but it does last much longer, at least 2 years. And then we have major depression, in which the severity of the symptoms interfere with one's ability to complete daily tasks or even enjoy life. So it's just a very, very consuming disease. And then contributing factors include traumatic and stressful experiences and major life changes, even if they were planned. And so an example of a life experience change, even if it was planned, is, for example, retirement, which is very relevant for older adults. And there's also like transitioning into living in a retirement home. Again, like even though it may be planned, this is just a major shift in their day-to-day life. So this can contribute towards depression. And there's also, unfortunately, the loss of a spouse, which is very, very serious for older adults as well, because there is already that existing grief and loss that they would have to cope with. And then their spouse was likely somebody that they had been with for a large period of time. So in addition to that, there is also just, again, that shift in their daily routine. And then there's also existing medical conditions such as stroke or cancer. And for very chronic and debilitating diseases as well, those can greatly contribute to depression. And then there's also the genetic aspect of this, in which a family history of depression can increase your likelihood of experiencing as well. And then risk factors include loneliness. An example of this I feel like a lot of us can relate to is, for example, quarantining and COVID. A lot of people conveyed just how lonely or sad they felt due to human interaction being a big part of most people's day-to-day lives. So loneliness can contribute towards depression. And then there's also problems sleeping. So insomnia, for example, is a contributing or a risk factor. And then there's also sedentary lifestyle, because for a lot of older adults, their mobility may be decreased with age. They may not have been as active as they once were. So that is also something to look out for. And then there's reduced functional ability to complete activities of daily living, because at that point, there is the loss of somewhat autonomy for these older adults if they're unable to complete their daily tasks on their own. And then there's also addiction and alcoholism that can contribute. And then statistics include depressive disorders affect about 10 to 20% of the world's older adult population. To put that in perspective, that is 1 in 5. So that this is a very serious disease. And then the prevalence of major depression in America's geriatric populations. So there's less than 1 to 5% for those that are in community living. And then there's up to 13.5% for those requiring healthcare in the home setting, and then up to 11.5% in hospitalized patients.
So for signs and symptoms, it is very important to point out that depression in older adults occurs differently compared to younger people. When one thinks of depression, the first thing they think of is sadness or mood changes, but is very different in older adults. And it's more common in people who have other illnesses, such as heart issues or any chronic issues. And unfortunately, healthcare providers mistake depression as a natural reaction to the illness. And most of the cases, it's not true. And so some common symptoms for depression in older adults is feeling worthless, loss of interest in activities, low energy or fatigue, and thoughts of death or suicide. And it's very also important to point out that for older adults, they also feel physical symptoms. So these are such as pain, any headaches, and indigestion, which is mostly due to any dietary changes such as eating more or eating less than they usually do. Depression is often confused with any signs and symptoms of dementia and delirium. So right here, we are going to compare and contrast them so it can be easier to point out if the older adult has depression. So for depression, the onset or how long it lasts is usually from weeks to months, whereas dementia is hours to days and delirium months to years. For mood, depression is mostly for older adults feeling low energy or uninterested in their daily activities. For dementia and delirium, their mood often changes, so they can feel high of energy, and then in a couple hours, they'll feel with low energy and tired. For the course or the treatment, depression is usually a long-term treatment, and the older adult usually responds well to the treatment. For dementia, is a shorter term and also responds well to the treatment, whereas delirium, it's a long-term course and can get worse over time. So for symptoms, as I mentioned before, depression, low energy levels, aches and pain, and sleep changes. For dementia is mostly confusion, trouble speaking or thinking, and many of older adults cannot do things on their own and need help to do their activities. And delirium is mostly cognitive inabilities such as memory loss, poor concentration, or changes in their personality.
So I'll be talking about management of minor depression symptoms. One of the ways that we can manage minor depression is through physical activity. Walking is the best and most accessible form of exercise for older adults. By walking around 20 minutes every day, we're able to improve mental health and clear harmful and bothersome thoughts. It also promotes blood circulation to the brain and decreases mortality rate by 46%. And it is able to strengthen muscles tremendously in older adults that are not doing other exercises. Active individuals also have lower risk of heart disease, stroke, diabetes, and colon cancer. Another form of physical activity is yoga, which is a low impact activity. Yoga helps promote mental clarity, calmness, awareness, and it relieves chronic stress and harmful thoughts. It allows for concentration and centering attention. And lastly, water aerobics is the best way to clear your mind while putting little to no pressure on fragile joints, which older adults have. Some of these exercises include aqua jogging, flutter kicking, leg lifts, standing water push-ups, and arm curls. And in the picture on the right, you can see them doing the standing water push-ups. And support groups are another way to manage minor depression symptoms. Earliest signs of depression mentioned before include feeling of loneliness and isolation. Support groups allow one to open up about their thoughts and current struggles in an unbiased space because other people in the group are also struggling with similar symptoms, which is why it's the best way to learn how to cope and manage depression through support groups. And a mental support group for older adults in Orange County is one that is in Westminster. I provided their address, the phone number, and their website on this slide. Major depression is different from minor depression. Management of major depression includes seeking professional help. Depression in elderly is not normal and should be given the same attention as depression in other populations. Older adults are more likely to feel depressed because of underlying conditions, difficult living situations, and isolation. Medication alone will not treat depression. Talking to professionals can help ease the loneliness and hopelessness felt by older adults that do suffer from major depression. And professionals can help by encouraging healing and showing how to cope with emotions properly. Depression can be diagnosed by individual's healthcare provider, and medication therapy can be advised. Most common antidepressants are SSRIs, SNRIs, TCAs, and MAOIs. Most of these have side effects that include nausea, headache, fatigue, dizziness, upset stomach, dry mouth, change in blood glucose levels, insomnia, and anxiety. It is important for individuals to monitor themselves and their overall mood. It's important that they stick to treatment plans that are provided by their doctor and report any reactions to their healthcare provider in order to minimize severe reactions.
And then catching the signs and symptoms of depression early on can help prevent further depression. So the sooner it is noticed and treated, the less severe it will likely become. Some of these early signs of depression in the older adult population include unexplained aggravation, loss of interest in hobbies, loss of appetite, disturbed sleep, and suicidal thoughts or fixations on death, and many more. So a healthy diet is important in preventing depression because our minds need the correct energy and nutrients in order to stay healthy. A nutritious diet should include lots of fruits and vegetables, proteins, healthy fats, and whole grains. And in order to prevent depression specifically, it is best to eat foods that are high in vitamin B9, which is folate, and vitamin B12. And then many of the exercises mentioned for managing depression can also be a great way to prevent depression as well as other physical illnesses. However, it is important to discuss diet and exercise restrictions with the patient's primary care provider, since each patient is different and certain foods and exercises may be contraindicated for some patients. And then regulating one's sleep cycle is incredibly important in preventing depression in older adults. The best way to do this is to make sure that the patient receives enough sleep throughout the night and enough natural daylight during the day. In order to prevent insomnia and disturbances in older adults, one should avoid bright lights and any screens about 2 hours before bedtime. And then physical health and mental health are closely related. So preventing and managing many chronic illnesses like diabetes and heart disease can help prevent depression in older adults. And then pets can be a great way to prevent depression as well, because pets can be great companions, and older adults tend to feel isolated and lonely, especially during the pandemic. And pets can be a fun and safe way to prevent loneliness in elderly people. And then volunteering is also a great way to access social and psychosocial resources. It can give older adults a sense of purpose. So here we have a few video resources that can help in reducing anxiety, stress, and other contributing factors to depression. So we'll play a little bit of each just so you can see.
Now bring your attention back to your breath. Notice what it feels like as it enters through your nose, goes down through your throat, filling your lungs, and back out through your nose.
You drift off into the future or into the past, just gently bring it back into the focus of the moment.
And then on this slide, we have a few phone numbers listed for different mental health hotlines. So if you or anyone you know is experiencing depression or any sort of mental illness, please give these numbers a call, and they should be able to help. And then here we have our references listed. So that concludes the end of our presentation. Thank you so much for watching. And if you have any questions, you can email this email number right here, which it's the email for Dr. Lee.